Hi, this is Dr. Atkins. Thanks for letting me explain your procedure to you over this video. I think this is also probably more effective because I recorded this video and had it reviewed by my staff to make sure that we were covering all the relevant points and answering most of the questions that patients had when we started discussing a procedure. So let's get started. Between now and your procedure, Alexa will be handling your scheduling and insurance verification. She will put your name down on our list of patients who need a procedure, and when the ban on elective procedures is lifted and we have protocols to limit the risk of coronavirus infection, she will contact you to schedule your procedure. After choosing a date, she will get insurance approval and give you a quote to see if you have any out-of-pocket expenses. She will go over detailed instructions with you beforehand. Now, we need to keep you healthy, so stay on your nasal steroid sprays and antihistamines, saltwater rinses, whatever you're doing to stay well. But putting you on antibiotics again is usually not of any benefit. If the antibiotics had worked in the first place, you wouldn't need this procedure. If you do have a flare-up and think you need to be treated, call us or go to atkinssinus.com to set up a telemedicine visit with Mike or myself anytime between now and your procedure. Now, let's talk about the day of your procedure. The procedure will be done with intravenous sedation, and we will start an IV before the procedure. After the IV is started, a board-certified anesthesiologist will use propofol to sedate you. It's the same type of anesthetic used for colonoscopies and upper endoscopies. You will be breathing on your own, but the propofol sedates you so you don't have any pain and you are not awake during the procedure. We will also give you IV medications for nausea and inflammation. Most procedures take anywhere from 20 to 40 minutes, and recovery time ranges from 30 minutes to 1 hour. You will need a driver to take you home. The day and evening of your procedure, you will be uncomfortable, and most patients need a couple of doses of narcotic that will be prescribed preoperatively. Some patients need a narcotic for a couple of days, but most can control the pain with Tylenol the day after the procedure. You will have some bloody drainage from your nose and sinuses for a couple of days after the procedure, but it is usually most annoying the evening after surgery. We will give you instructions on how to minimize this. For the first few days, you will have congestion and bloody drainage off and on, and you shouldn't plan any significant activities, but you won't be bedridden. With regards to going back to work, if you have your balloon sinuplasty on a Thursday or Friday, you can return to work on Monday if you have a desk job. The exception to this is if you have a septoplasty done along with your balloon sinuplasty. In this case, you will need to be off a week. I will discuss this more under the septoplasty section. If you must travel for work or do heavy lifting at your job, discuss with Alexa when you can return to work. What is the success rate of these procedures? This, of course, depends on your individual circumstances and the degree of surgery you have. A report from United Healthcare last year showed my revision rate was about 5%, which was well below the national average. In general, most patients, but not all patients, get a good outcome and are pleased with the results. The next few minutes of this video will go over the specifics of each type of procedure I do. You should have been given a sheet with the procedures you will need marked on it. The time points on the sheet correspond to time points in this video, so you can jump to the points relevant to your procedure. A summary of the time points is included in the description below. If you have any questions, please reach out to Alexa. She is more than willing to help. Any questions she can't answer, she will forward to me. Her email is alexa@atkinssinus.com. Now, let's talk about balloon sinuplasty. Balloon sinuplasty widens blocked or narrowed sinus passages. It is minimally invasive because it does not remove any tissue, and the passages stay open 97% of the time, and it does not cause any bruising. In this example, this blue tube represents a sinus passage. This red object represents the balloon. When you dilate the balloon, you widen the passage. This wider passage leads to less sinus infections, less facial pressure, less congestion, and frequently less headaches. This is how it's done in real time. That wire is being threaded into the sinus. A balloon is being advanced over the wire. The balloon is being dilated. It doesn't have to be left up for very long, and it's deflated and removed, and then we go to other sinuses and repeat that. The good news is we are the only practice in San Antonio that has an image-guided computer called Trudy in our office to help make balloon placement more accurate and safer. In the previous video, you saw the wire being advanced. In the following video, I'm going to show you how to track that wire in real time. There's a link to a video on why Trudy is so awesome in the description below. So this is what Trudy can do for us. You can see as I move this wire around, it's tracking the wire in real time on this patient's CT scan, allowing me to get the wire in the right position, and therefore I get the balloon in the right position for an accurate dilation. Most patients have 8 sinuses, 6 of which can be treated with balloon sinuplasty. The 2 sinuses that can't be treated with balloon sinuplasty are the ethmoid sinuses. They can't be dilated with a balloon because, unlike the other sinuses that have one entrance and one exit, the ethmoids are shaped like a honeycomb, so there's no one particular spot that you can dilate. In the old days, ethmoid surgery used to require roto-rooter surgery. Now we just open the front of the ethmoids and let the back of the ethmoids drain through the small opening we make. This is slightly invasive compared to balloon sinuplasty because tissue is removed, but I'm careful to remove as little tissue as necessary. This does not cause bruising. And here's what that looks like. I'm opening the front of the ethmoids, making a hole, and then the back of the ethmoids will drain through that hole. The inferior turbinates are in the bottom of your nose. They sit from front to back and are the size and shape of a link Jimmy Dean breakfast sausage. They are a major cause of nasal obstruction. I use a technique called submucosal resection to treat enlargement of the inferior turbinate. I have a YouTube playlist describing inferior turbinates and the problems they cause, as well as the treatment options. There's a link to the playlist in the description below. The nasal septum is the cartilage and bone in the middle of your nose that separates the right and left side of your nose. When the septum is crooked, it can cause nasal congestion or keep the sinuses from draining. Traditional septal surgery is done by opening the septum and removing crooked bone and cartilage. A less invasive way is to use TRACT, which is an airway balloon to straighten the septum. It is different from a sinuplasty balloon and designed to treat septal deviations. Most patients I use a TRACT on need to have soft silicone splints placed to keep the septum straight while it heals. TRACT will not change the shape of your nose and you will not be bruised. The splints have breathing channels that allow you to breathe through your nose while healing. They are typically removed 6 days after surgery. Patients who have TRACT should plan on taking a week off and having more pain and bleeding than balloon sinuplasty patients alone. You won't be able to see the splints because they will be up inside your nose. Sometimes after TRACT, there is still a small deviation of the septum that I have to remove endoscopically, but even then, TRACT is still less invasive than a traditional septoplasty. I have a detailed YouTube video on TRACT. A link to the TRACT video is in the description below. In conclusion, I hope this answered most of your questions. If there's anything you still need answers to, please get a hold of Alexa. She'll be happy to help. And please reach out to us if you start feeling miserable between now and your scheduled procedure time. Thanks.